Let's discuss the extraordinary vessels, Qi reservoirs. The extraordinary vessels are called extraordinary because they do not belong to the main channel system. They do not have exterior-interior relationship, and they add something to the channel system. With the exception of the governing and directing vessels, the extraordinary vessels do not have their own points as the main channel do, but they flow through points of various main channels. Therefore, each extraordinary vessels influences more than one main channel. As we will see shortly, this is an important characteristics and accounts for their clinical use. The 8 extraordinary vessels and their opening points are direct vessels, lung 7, governing vessels, SI3, penetrating vessels, spleen 4, girdle vessels, GB41, yin linking vessels, P6, yang linking vessels, TB5, yin stepping vessels, kidney 6, yang stepping vessels, bladder 62. As the governing and directing vessels have their own points, they have the dual quality of a main channel and an extraordinary vessels. For this reason, the main channel are sometimes counted as 14 rather than 12. As we shall see shortly, this accounts for an important difference in the use of the points of these two vessels compared to the other 6. The extraordinary vessels as reservoirs of Qi. The extraordinary vessels act as reservoirs of energy in relation to the main channel, which are compared to rivers. This idea comes from the Classic of Difficulties in chapter 27 and 28. In chapter 27 of the Classic of Difficulties, it says the sage built ditches and reservoirs, and they kept the waterways open in order to be prepared for above normal situation, like floods. When there are heavy rains, ditches and reservoirs are full to the brim. In the human body, when the channels are overfilled, they cannot absorb the excess, and this overflow from the main channel is absorbed by the extraordinary vessels. The Classic of Difficulties repeats and expands on the previous chapter. The sage build ditches and reservoirs. When these are full, they overflow into the deep lakes. In the human body, when the channels are overfilled, they overflow into the 8 extraordinary vessels where they are no longer part of the general circulation. The study of the 8 extraordinary vessels by Li Shixuan says, in a similar way, when the qi of the channels overflow, it flows into the extraordinary vessels where it is turned into irrigation, warming the organs internally and irrigating the space between skin and muscles externally. The influence of the extraordinary vessels on the space between skin and muscles implies their important role in protection from pathogenic factors. The extraordinary vessels are like reservoirs, absorbing the overflow of excess qi from the main channels, which are like canals. As we shall see shortly, the yin and yang stepping vessels are the first in line to perform this function. This is for the reason why their pathology consists primarily in excess of yin or yang. As the extraordinary vessels have many intersections with the main channel, they integrate and regulate the channel system and absorb overflows from the main channels. The yin and yang linking vessels and the yin and yang stepping vessels are particularly good example of this. To take the yang stepping vessels as an example, these vessels connects with many channels. It starts from the bladder channel and connects with the gallbladder, small intestine, large intestine, stomach, triple burner, and bladder channels, and the directing and yin stepping vessels. This means that the extraordinary vessels can both absorb energy from the main channels and transfer energy to them when needed. This happens in cases of shock, for example. So we have here illustration, the reservoirs of qi absorbing excess qi from the main channels. Qi and reservoirs warm the organ internally and irrigates the space between skin and muscles externally. The extraordinary vessels can both absorb qi from main vessels and transfer qi to them. Okay. Thank you for your attention.
Let us now discuss the liver channel points. Tonification point is liver 8. Sedation point is liver 2. Liver 2 is for liver fire and excess, yin, normal, yang, excess, excessive menstrual flow, stagnant excess, heat or hypertensive headache or headache with lots of heat and angry. Liver 3 for draining heat, yin deficiency, most common channel point for headaches, strong calming effect on nervous system, excessive bleeding, blood storage problems, more for regulating menses and cycles. Liver 4 is for hepatitis and leg circulation problems. Liver 5, genital problems, gynecological problems, or herpes. Liver 6 is for acute hepatitis. Liver 8 for herpes and genital issues. Liver 5 is used more. Liver 8 is more cooling, nourishing. Liver 5 more dispersing. Liver 13 is the front mu of the spleen, and liver 14 is the front mu of the liver. Specific points according to function. Yuan source point is liver 3. Luo connecting point is liver 5. Shi cleft is liver 6. Associated bakshu point is bladder 18. Associated front mu point is liver 14. Jingwell point or wood point is liver 1, pen point of the 5 phases. Ying spring point or fire point is liver 2. Shoestring point or earth point is liver 3. Jing river point, metal point is liver 4. Hussy point, water, is liver 8, and also a tonification point. Hui meeting point of the Zhang organs, liver 13. Then we have the Jiao Hui meeting points with the gallbladder channel and the Tai Mai, liver 13. With the Yin Wei Mai and the stomach channel, liver 14. Of other channels with the liver channel, spleen 6, spleen 12, spleen 13, Ren 2, Ren 3, Ren 4, pericardium 1, do 20. Ma Dan Yang, heavenly star point, is liver 3. Front mu point of the spleen is liver 13. Points according to region. Local points for the liver is liver 13. For the knee, liver 7. Liver 8, foot, liver 4. Adjacent points, stomach, spleen is liver 13, hypochondrium, liver 13, liver 14. Distal points, for the vertex, liver 3, eyes, liver 2, and liver 3. For the liver, liver 3. For the gallbladder, liver 3. Urogenital region, liver 3. Genital region, liver 5. Lower abdomen, liver 8. Specific points according to the channel pathway in numeric order. Liver 1 is Jingwell point or wood point. Liver 2 is Ying spring point or fire point. It is also the sedation point and distal point for the eyes. Liver 3 is Yuan source point, shoestring point or earth point, Ma Dan Yang heavenly star point, distal point for the vertex, eyes, liver, gallbladder, and urogenital region. Liver 4, Jing River point is metal, local point for the foot. Liver 5, Luo connecting point, is the distal point for the genital region. Then we have liver 8 is liver 6 is Shi cleft point. Liver 7 is local point for the knee. Liver 8 is Hussy point or water point, tonification point, distal point for the abdomen, local point for the knee. Liver 13 is the front mu point of the spleen, Hui meeting point of the Zhang organs, Jiao Hui meeting point with the GB channel and the Tai Mai, adjacent point for the spleen or stomach and the hypochondrium. Liver 14, the associated front mu point, is also the Jiao Hui meeting point with the Yin Wei Mai and the spleen channel and regional point for the hypochondrium. Thank you for your attention.
Let's discuss the Chong Mai penetrating vessels pathway. Synonyms: penetrating vessels. Relationship: yin and yang, Chong Mai, Dai Mai. Central peripheral: Chong Mai, Yin Wei Mai. Regions supported by this pairing: heart, thorax, stomach. Opening points: spleen 4. Coupled point: AC6. Pathway. The extraordinary vessels Chong Mai originates like the Du Mai and Ren Mai in the lower abdomen at Bo Zong in women in uterus, or according to some authors, at the kidneys. It crosses the genital area and divides into two branches. A deep branch reaches the perineum at Ren 1, travels to the spine, penetrates the spinal canal, and ascends to the level of T1 and T2. According to some authors, the vessels ascending the anterior aspect of the spine. The other branch emerges at stomach 30 to the surface of the body and divides into two external branches, one descending and one ascending branch. The ascending branch reaches kidney 1, 0.5 June lateral to the midline at the level of the pubic symphysis, and from there follows the kidney channel to kidney 21. The kidney channel initially ascends the abdomen at a distance of 0.5 June from the midline, passing kidney 12, kidney 13, kidney 14, kidney 15, runs to the midline meeting Ren 7. 1 June inferior to the umbilicus and again returns to its pathway 0.5 June lateral to the midline, passing kidney 16, kidney 17, kidney 18, kidney 19, kidney 20, and kidney 21. The vessels then disperses into the intercostal spaces, ascends the neck, circles the inner surface of the lips, and spreads in the upper pharynx and the nasal cavities. The descending branch meets the kidney primary channel and descends the medial aspect of the thigh. According to Ling Shu, it divides into 3 foot-yin channels. The penetrates the popliteal fossa, follows the medial border of the tibia, and emerges posterior to the medial malleolus, where it divides into 2 sub-branches. One branch travels along the anteromedial aspect of the foot to the big toe. The other branch reaches the sole of the foot. Connections with other channels and organs. Kidney primary channel, Renmai, Dumai, stomach and liver primary channels. Kidney, uterus. Clinical importance, sea of blood, strong connection to the various functions of the blood. Strong relationship to the uterus, regulates the menses. Regulates the 12 primary channels, effectively regulates the circulation of the blood in the whole body, regulates the counterflow of qi. Connects to the stomach and kidney primary channels and strengthens the relationship between the Renmai and Dumai. Thank you for your attention.
Let's discuss the Dumai or governing vessel points. The points affect genitals, back, head, brain. Important mental effect, they tonify the kidneys and they extinguish internal wind. The Du channel Luo point is Du1. Du3 is the back for the back issues, urogenital problems, and tonifies the yang. Du4 has the same function as Du3. Du9 for the liver, gallbladder, hepatitis, or jaundice. Du10, chest, asthma, boils, carbuncles. Du11 for the spirit, heart, expression. Du12 for the lungs, spirit, spine stiffness. Du13, heat, fevers, malaria. Du14, high fevers, malaria, skin and blood problems. Du15 is the door of muteness for neck problems. Du16 for wind, colds and flus, headaches, and neck pain. Du17 is for depression. Du20, liver wind, headache, dizziness, hypertension for descending problems. Du23 for the sinuses and eyes. Du26 is a revival point, good for shock, low blood pressure, gums. Specific points according to their function. Luo connecting point is Du1. Then we have the opening point is SI3, pertaining coupled point is bladder 62. Luo connecting point is Du1. Now specific points according to their function. And Jiao Hui meeting points with the gallbladder and kidney channels and the Renmai is Du1. With the bladder channel, Du13. Jiao Hui meeting point with all yang channels is Du14. meeting point with the yang Wei Mai, do 15, with the yang Wei Mai and the yang Chao Mai, do 16, with the bladder channel, do 17, with the bladder, GB, TB, and liver channels, do 20, with the bladder and stomach channels, do 24. With the LI and stomach channels, do 26, with the Renmai and stomach channel, do 28, and of other channels with the Tumai, Ren 1, bladder 12, stomach 1, bladder 1, bladder 23. Window of heaven point is do 16. Sea of Qi is do 14 and do 15. Sea of Marrow, do 16 and do 20. Madanyang heavenly star point, we have none. Then the Sun Si Miao ghost point, do 16 and do 26. Very important point for strengthening the yang with Mox Sebastian is 2 for important emergency point is 226. Points according to region. Local points, temporal region, we have do 20. For the nose, do 25. Rectum, do 1. Lumbar spine, do 3. And do 4. Adjacent points for occipital region, do 14. Temporal region and the eyes, do 23. Nose, do 23. Do 24. For the lungs, do 14. Heart, do 11. Cervical spine, do 14. Distal points for the tongue, do 15. Rectum, do 20. Lumbar spine, do 12. And do 26. Specific points according to the vessel pathway in numerical order. Do 1 is the luo connecting point. It is also the Jiao Hui meeting point with the GB kidney channels and the Renmai. It is the local point for the rectum. Do 3 is local point for lumbar spine. Do 4 is very important point for strengthening the yang with Mox Sebastian. Do 11 is the adjacent point for the heart. Do 12, distal point for the lumbar spine. Do 13 is the Jiao Hui meeting point with the bladder channel. Do 14, Jiao Hui meeting point with all yang channels. Point of the Sea of Qi, adjacent point for the occiput and lung, adjacent point for the cervical spine. Do 15, Jiao Hui meeting point with the yang Wei Mai, Sea of Qi point, and distal point for the tongue. Do 16 is the point of the Sea of Marrow, window of heaven point, Sun Si Miao ghost point, Jiao Hui meeting point with the yang Wei Mai and the yang Chao Mai. Do 17, Jiao Hui meeting point with the bladder channel. Do 20, Jiao Hui meeting point with the bladder, GB, TB, and liver channels. Point of the Sea of Marrow, local point for the temporal aspect of the head, distal point for the rectum. Do 23 is the regional point for the temporal region, the eyes, and the nose. Do 24 is the Jiao Hui meeting point with the bladder and stomach channels, adjacent point for the nose. Do 25 is local point for the nose. Do 26, Jiao Hui meeting point with the LI and stomach channels. Sun Si Miao ghost point, distal point for the lumbar spine, and is an important emergency point. Do 28 is a Jiao Hui meeting point with the Renmai and stomach channels. Now let's discuss the luo connecting vessel of the Tumai. The luo connecting vessel of the Tumai originates at 2-1 between the anus and the tip of the coccyx, bilaterally ascends the spine to the neck and disperses in the occipital region, where it connects with the bladder primary channel. Both course together to the shoulder region. There, the luo connecting vessel enters deeper into the body at the level of the scapula and spreads in the paravertebral musculature. In clinical importance, excess means limited range of motion and stiffness of the spine. Deficiency indicates heavy sensations of the head, dizziness, balance disorders. Thank you for your attention.
Let's discuss the Chong Mai, penetrating vessels, rebellious Qi. One of the most common pathologies of the penetrating vessel is the rebellious Qi and internal urgency. This has been recognized since the times of the Classic of Difficulties. Chapter 29 of the Classic of Difficulties says, the pathology of the penetrating vessel is rebellious Qi with internal urgency. The internal urgency indicates a feeling of vague anxiety and restlessness. It may also be interpreted on a physical level as uncomfortable, tight sensation from the lower abdomen upwards towards the heart. Modern Chinese book says that internal urgency may also indicate pain, constipation, retention of urine, hernia, anxiety, dizziness, and nausea, especially with an emotional background. Li Shishan said, when qi rebels upward, there is internal urgency and feeling of heat. This is a rebellious qi of the penetrating vessel. Rebellious qi of the penetrating vessel causes various symptoms at different levels of the abdomen and chest. It causes primarily fullness, distension, or pain in these areas. By plotting the pathway of the penetrating vessel, we can list the possible symptoms of rebellious qi of the penetrating vessel starting from the bottom. So we have here the schematic representation of rebellious qi of the penetrating vessels. So from the face, from the uterus and blood, goes to the face, and also goes down from Ren1 to the legs. In the pathology of rebellious qi, from abdominal symptoms, there is qi rebellious, and it produces a hot face. Then going to the qi deficient leg branch, there is a cold feet. So we have here the symptoms of rebellious qi of the penetrating vessels. There's a feeling of anxiety, restlessness, fidgetiness. There's headache, a feeling of heat in the face, a feeling of lump in the throat, breast distension, pain in women, flutter in the chest or above the stomach, nausea. There's palpitations like breathlessness, tightness, oppression of the chest, hypochondrial fullness, distension, pain, epigastric fullness, distension, pain, umbilical fullness, distension, and pain. Lower abdominal fullness, distension, pain, irregular, painful, heavy period, hypogastric fullness, distension, and pain. Obviously, not all these symptoms need to occur simultaneously to diagnose rebellious qi of the penetrating vessel, but it is necessary to have at least 3 to 4 symptoms at different level. That is in the lower abdomen, epigastrium, chest, and throat. For example, if someone had fullness distension or pain of the lower abdomen, that will not be enough to diagnose the condition of rebellious qi of the penetrating vessel. A feeling of energy rising from the lower abdomen up towards the throat would be a strong indication of rebellious qi of the penetrating vessel. What makes the qi of the penetrating vessel rebel upward? So this may happen to 2 reasons manifesting with 2 conditions. One full, the other mixed full or empty. Firstly, the qi of the penetrating vessel can rebel upward by itself from emotional stress that makes qi rise or stagnate, such as anger, repressed anger, worry, frustration, resentment. In this case, qi rebels upward by itself and the condition is full, and this primary rebellious qi of the penetrating vessel. Qi of the penetrating vessel may rebel upward also as a consequence of deficiency in this vessel in the lower abdomen. In such cases, qi of the lower dantian is weak and the qi of the penetrating vessel escapes upward. This is therefore a mixed full or empty condition, and this secondary rebellious qi of the penetrating vessel. The empty condition is deficiency of blood and or deficiency of kidneys, which may be yin or yang. This second condition more common in women. Li Shishen mentioned the possibility of this pattern when he says, when there is blood deficiency leading to internal urgency, use Dang Wei. The classic categories also hints the blood deficiency as a background for rebellious qi of the penetrating vessel. The qi of the penetrating vessel rises up to the chest. Qi is not regulated and therefore it rebels in the diaphragm. Blood is deficient and therefore there is internal urgency in the abdomen and chest. Primary rebellious qi of the penetrating vessel. The qi of the penetrating vessel rebels upward by itself from emotional stress that makes qi rise or stagnate. So there is a full condition. Secondary rebellious qi of the penetrating vessel. Qi of the penetrating vessel rebels upward as a consequence of a deficiency of blood in kidneys. in this vessel in the lower abdomen. So there's full or empty condition. In particular feature of the syndrome of rebellious Qi of the penetrating vessel is that it is characterized by the feeling of heat in the face and cold feet. This is due to the fact as Qi rebels upward towards the face, it causes a feeling of heat there. On the other hand, as it rebels upward, there is proportionately less Qi in the descending branch of the penetrating vessel, which causes cold feet. In fact, as had been above, the old text specifically says that the descending branch of the penetrating vessel warms the feet. An example of treatment of the primary rebellious Qi of the penetrating vessel, example of the full type in women is spleen 4 on the right, pericardium 6 on the left, Li4 on the right, liver 3 on the left, kidney 14 bilaterally, and kidney 21 bilaterally. An example of treatment of the secondary rebellious Qi of the penetrating vessel, for example, of the full and empty type, against the background of the blood and kidney deficiency in women is spleen 4 on the right, pericardium 6 on the left, Li4 on the right, liver 3 on the left, kidney 13 bilaterally, Ren 4 and kidney 21 bilaterally. Rebellious Qi of the penetrating vessel may also cause dizziness, for which one can use DO20, bladder 11, stomach 37, stomach 39. Rebellious Qi of the penetrating vessel may also cause nausea, in which case one can use bladder 11, stomach 37, stomach 39, stomach 30. Thank you for your attention.
Let's discuss the clinical applications of yang Chong Mai or yang stepping vessel. The yang stepping vessel is the first line of reservoirs to absorb excesses of yang, but it does so primarily in the head. Excess of yang in the head can manifest in a variety of ways. For example, liver fire or liver yang rising, affecting the head, liver wind. Absorbing excess yang from the head also has a mental implication, as the yang stepping vessel is used for mania and agitation. Absorbing excess yang from the head also implies extinguishing internal wind, and the yang stepping vessel is used for wind stroke, facial paralysis, aphasia, numbness, or epilepsy. It may also be used to expel exterior wind from the head for symptoms of aversion to cold, fever, sneezing, headache, stiff neck, runny nose, and floating pulse. It is particularly indicated if the exterior attack is accompanied by severe headache and stiff neck. The yang stepping vessel brings yang qi to the eyes. The yin stepping vessel brings yin qi to the eyes. When the yang stepping vessel is full, there is too much yang qi in the eyes and they cannot close, so that the person suffers from insomnia. To correct this, one can drain the yang stepping vessel by reducing bladder 62, tonify the yin stepping vessel by reinforcing kidney 6, and insert bladder 1 to establish communication between these two vessels at the level of the eye so that excess yang is drained away and yin is transported to them. Excess of yang in the head has also an implication on the mental level, and the yang stepping vessel can be used for mania, agitation, or insomnia. A particular indication for the use of the yang stepping vessel in these mental conditions is a pulse that is full and wiry on both front positions of left and right. In ancient texts, it is indicated in cases of attraction to ghosts and demons and missing a dead relative excessively. The 1,000 golden ducat prescriptions indicates the yang stepping vessel for fright, seeing ghosts, and manic depression. The yang stepping vessel is very useful to treat unilateral backache and sciatica. In channel problems, the extraordinary vessels are particularly indicated when the symptoms overlap several channels. For example, yang stepping vessel is indicated in sciatica when the pain affects the bladder, gallbladder, and stomach channels, or just the bladder and gallbladder. In such cases, we have to needle bladder 62 on the affected side and SI3 on the opposite side. If there is pronounced stiffness, we add the she cleft point of the young stepping vessel, that is bladder 59. After leaving these needles in for 15 minutes, we then ask the patient to turn over and we treat the local points on the back. The young stepping vessel is particularly indicated in back problems occurring against the background of a full condition and the pulse is full and wiry. We do not use the young stepping vessel when the backache is bilateral. So the young stepping vessel is excellent to treat sciatica when the pain overlaps among the gallbladder, the bladder, and stomach channels. Use bladder 62 on the affected side, SI3 on the opposite side, and leave in for 15 minutes, and then use local points. As the young stepping vessel flows through the GB29, this vessel affects both the bladder and gallbladder channels in the hip area. For this reason, we use the young stepping vessel to treat hip pain. In such cases, use bladder 62 on the affected side and SI3 on the opposite side. After retaining these points for 15 minutes, ask the patient to lie on the opposite side so that we can needle GB30. Thank you for your attention.
Let's discuss the Dumai governing vessel. Symptoms. Pathway. The Dumai arises from the kidneys. It emerges in the perineum between the anus and coccyx and travels to GB1. From there, it flows up the spine to GB16. Here, a branch enters the brain. It emerges at GB20. From GB16, another branch travels over the forehead to the tip of the nose and ends at the frenum of the upper lip. Another branch connects GB13 with bladder 12 and bladder 13. The Dumai consists of an ascending and descending branch and a luo vessel. The ascending branch begins at CB3, follows the pathway of Renmai to the navel. There it connects with the tendinomuscular channel of the spleen, enters the heart and ascends to bladder 1 on the face. The descending branch also begins at CB3. It connects at the buttocks with the tendinomuscular channel of the bladder and ascends to bladder 1. From here, it follows the bladder channel and descends to bladder 23, where it enters the kidney. The luo vessels of Dumai starts at GB1 and ascends running parallel to the spine to GB16, where it overflows over the skull. Dumai, the function. Dumai controls the entire yang of the body and can be used to boost yang and increase kidney yang. Dumai strengthens the spine, especially the low back, in combination with feelings of coldness and or stiffness. Dumai nourishes the marrow, the brain, and bone marrow in the spine. Dumai circulates the defensive Wei Qi, especially in neck and back. Dumai disperses exterior and interior wind. Symptoms. Impotence, premature ejaculation, spontaneous ejaculation, infertility, decreased libido, hemorrhoids, vaginal discharge, prolapse of the uterus, urinary bladder weakness, incontinence, aversion to cold, chronic fatigue, low back pain, painful spinous process in the entire spine, back stiffness, dizziness, forgetfulness, developmental disorders, neurological dysfunction, common cold, spontaneous perspiration during the day, and CFS, epilepsy. Dumai palpation, the spinous process of the vertebra, entire spine are palpated for pressure pain. The patient lies in supine position. The practitioner slides his hand flat under the back of the patient and presses with the fingertips against the spinous process of the vertebra along the entire spine and notes any painful areas. So we have here the illustration on how to palpate. Dumai point, the confluent point, SI4, Yang Chong Mai coupled point. The coupled point, bladder 62, Yang Chong Mai confluent point. Dumai disease patterns. The following Sangpo disease patterns can appear similar to a Dumai problem and have to be promptly differentiated. Kidney yang deficiency, spleen Qi deficiency, spleen yang deficiency, lung Qi deficiency, heart Qi deficiency, heart yang deficiency, wind heat in the lungs, wind cold in the lungs, and liver wind. Thank you for your attention.
Now let's discuss damp phlegm in the lungs, a pattern under cough. So chronic cough may be of the full or empty type. The main patterns are as follows. Under full, we have damp phlegm, phlegm heat, phlegm fluids, and liver fire. Empty, lung Qi deficiency, lung yin deficiency, and lung dryness. The pathology of chronic coughs is characterized by involvement of other organs besides the lungs. The organs involved for each pattern are as follows. So for damp phlegm, we have spleen Qi or spleen yang deficiency, kidney yang deficiency. For phlegm heat, spleen Qi deficiency. Phlegm fluid, spleen and kidney yang deficiency. Liver fire insulting the lungs, liver fire. Lung Qi deficiency, we have spleen Qi deficiency. Lung yin deficiency, kidney yin deficiency. For lung dryness, stomach yin deficiency. Thus, the pattern of lung Qi deficiency will be nearly always accompanied by spleen Qi deficiency, while that of lung yin deficiency will be nearly always accompanied by stomach and or kidney yin deficiency. Damp phlegm in the lungs. Clinical manifestations, repeated attacks of cough, profuse expectoration of white sticky sputum, breathlessness, worse in the mornings and after eating, feeling of oppression in the chest, feeling of fullness of the epigastrium, nausea, poor appetite, tiredness, feeling of heaviness, loose stools. Tongue is pale or normal, with swollen, sticky, thick white coating. Pulse is slippery. This is a common pattern seen in chronic cough, especially in middle-aged and elderly patients. Treatment principle, dry the dampness, resolve phlegm, tonify spleen, restore descending function of lung Qi, stop cough. Points, lung 5, lung 1, Ren 12, bladder 20, stomach 36, Ren 9, stomach 40, spleen 6, bladder 13. Reinforcing method on stomach 36, Ren 12 and bladder 20, reducing or even method on the others. Moxa is applicable. Lung 5 resolves phlegm from the lungs and restores descending of lung Qi. Lung 1 restores descending of lung Qi. Ren 12, bladder 20, and stomach 36 tonify the spleen to resolve phlegm. Ren 9, stomach 40, and spleen 6 resolve dampness and phlegm. Bladder 13, Bakshu point, is used for chronic patterns to restore the sending of lung Qi. Thank you very much for listening.